Hello, I'm Dr. Langston Smith, Deputy Surgeon General for Dental Health, Alpha Phi Alpha Fraternity Incorporated. I'm a board certified endodontist and practiced general dentistry and endodontics for 42 years. This time I have with you, I would like to discuss an oral health condition that doesn't get talked about as much as other conditions. But this condition can be quite damaging, and if not treated, can be fatal. The conversation that I would like to have with you is that on oral cancer. Why this conversation? Well, 3% of all cancers diagnosed in the United States are oral cancer. Oral cancer is the fourth leading cancer in Black men and the seventh leading cancer in white men. There's a particular interest that there is a 57% survival rate of oral cancer. Now, the American Cancer Society projects that over 54,000 cases of oral cancer will be diagnosed in 2022. And that there will be approximately 11,000 deaths related to oral cancer. Oral cancer is more prevalent in older people, with 63 being the average age of occurrence. And that is why I want to have this conversation with you, to make you aware of this condition and how to manage it. What are the signs and the symptoms, and all the information that I can share with you on oral cancer in the time that I have. So, what is oral cancer? Well, we all know what cancer is and the effects that it has on the body. But oral cancer is a cancer that starts in the mouth or throat. And it can be associated with the lips, the gums, the tongue, the cheek, the floor of the mouth, the roof of the mouth, or jaws. Anything dealing with the throat or oral cavity, the mouth, would be classified as oral cancer. So, what are the risk factors associated with oral cancer? Well, oral cancer is found highest in smokers and those that use excessive alcohol. Okay? Then it occurs generally in folks older than 50, as we've stated, with the average age of occurrence being 63. It is found in those individuals who work a lot outdoors, where their lips are exposed to the sun, so excessive exposure to the sun. And recently, it has been associated with the human papillomavirus, the HPV virus. Okay, these are the high risk folks that are susceptible to oral cancer. So now, what are the risks? What are the signs and symptoms of oral cancer? We can see red and white patches. If you find red or white patches of the tongue, the cheeks, the jaws that last for more than 10 days. If you have mouth sores or ulcers in the mouth that don't heal. If you experience numbness of the tongue or a lump or thickness in the soft tissue, that is the gums and the cheeks. If you feel like something is caught in the throat, or you're hoarse, or have a change in your voice that lasts for 2 weeks or more. And lastly, if there's an unexplained mouth pain that does not go away, these are signs or symptoms that a condition may be oral cancer. But it may not be oral cancer. And the only way to determine that is to have an evaluation, get checked out by your dentist. Okay? So I would like to show some slides on how oral cancer appears. So these slides may be a little bit uncomfortable for you, but I would like to show these appearances. Here you see the white patch that we talked about, okay? And this can appear on the tongue or on the cheeks, all right, or the gums. And here you see the red patch, okay, that you see here on the palate. And this is how those red and white patches may appear. Here we have oral cancer of the tongue. You can see it right here. Or an ulcerated condition, which is oral cancer, on the dorsal, the back side of the side of the tongue, okay? And of the palate, cancer of the palate, and of the lip. And this individual must have worked outdoors excessively with unprotected lips, okay? And here's cancer of the jaw. I apologize for the sites here, but this is what it appears like, okay? So if cancer is diagnosed, if oral cancer is diagnosed, how is it managed? How is it treated? And this you should know. It requires a multidisciplinary approach. It's a team approach to treating oral cancer. And that team would consist of oncologists, surgeons, oral surgeons, dentists, and nutritionists. And together, they map out the treatment protocol that is best for that particular cancer. Radiation therapy, surgery, or chemotherapy are the three protocols. It could be either one or a combination of these therapies, okay? But in any case, if there is a diagnosis of oral cancer, don't delay treatment. I want to go back to the point I made earlier that there is a 57% survival rate. So don't delay treatment. And if diagnosed, treat it aggressively. In any case, we have to talk about prevention, because prevention is the key to early detection, okay? So how do we prevent it? Reduce smoking and tobacco use. Reduce smoking and tobacco use. Reduce excessive use of alcohol. Now, these two combined, smoking and alcohol, gives you a double whammy. All right, so we find that there's a higher incidence when these two are combined in excess. Reduce excessive unprotected exposure to the sun. Always use lip protection when you're spending a lot of time in the sun. Always inspect your oral cavity. Always inspect your mouth and look for these things. It doesn't have to be every day or every week, but periodically look in and see and note any changes, okay? And then make sure your dentist does an oral cancer screen during your annual exam. And if your dentist doesn't do a cancer screen, please ask him or her to do that screen for you. This is how we prevent oral cancer. So I want to thank you for joining me. And it has been wonderful to speak with you on oral cancer. And to summarize what we have talked about here is, number one, we have discussed oral cancer to make you aware of it. We talked about the risk factors associated with oral cancer. We identified signs and symptoms for you that are associated with oral cancer. And then I showed you some clinical examples of what oral cancer looks like. And then we talked about the prevalence and incidence of oral cancer and preventive practices that you should employ. And we stated that oral cancer has now been linked to the human papillomavirus, the HPV virus. And the final point that I want to leave with you is that get your oral cancer screened by your dentist during your annual examination. So thank you very much. And I hope that you've gotten some information regarding, and that you're a little bit more knowledgeable of oral cancer than before. Thank you, thank you, thank you.